Hi, I'm Annelise, nurse practitioner and clinical advisor here at Feel30. In this video, I'm going to walk you through how to perform an intramuscular injection of testosterone safely and yes, with confidence. So first, always gather all your supplies, the testosterone vial, your syringes, the two types of needles that you'll use, one to draw from the vial and the other to inject, as well as alcohol wipes and your sharps container. Always wash your hands thoroughly. Soap and water, hand sanitizer, both are fine. If it's a brand new vial, pop the plastic covering off. If it's one you've been using, just making sure that you're always wiping that rubber stopper with an alcohol wipe before you puncture. Attach the larger gauge needle to the syringe, and then you're gonna puncture the vial and draw back that prescribed amount of testosterone. When you're taking the vial off, you should use a safety needle so you can just kind of slide the little plastic cap over it. If you don't, you'll have to recap the needle, which does put you a little bit more at risk for a needle stick, so just be cautious. Once you do that, you can remove the larger gauge needle, and then you'll attach the smaller gauge needle that you're actually going to be injecting with. For the site of injection for an intramuscular, you can technically use the shoulder, but it should never be any volume more than 1 ml, or you can use the outer thigh or the upper outer glute. Once you've picked your area, wipe it with alcohol, let it air dry, and you're gonna inject yourself the entire length of the needle into that area. If your doctor or provider tells you to aspirate, what they mean is by holding onto the needle, you'll pull back on the plunger, and that's to make sure that you're not in a vein. You'll know you're in a vein because there may be a little bit of blood that goes in. If that happens to you, just go ahead and pull out, clean another area, and try one more time. When you aspirate and pull back, there's no blood, you can go ahead and push medication in, wait a second, and then pull it out, throw it in your sharps container. If you miss a dose and it's been more than 24 hours, just go ahead and skip it and return to your regular schedule. You never want to double up or increase your dose because you've missed one. If in the area of injection you get a small lump or some redness or some type of reaction, that is normal when we are injecting ourselves. But if those symptoms persist past maybe 2 or 3 days, you can go ahead and contact your Feel30 team. Remember that energy and brain fog and clarity should improve within 2 to 4 weeks. Things like libido and muscle improvements is really longer term, 6 to 8 weeks. Always store your testosterone away from your children and pets, and make sure that you dispose of all needles in sharps containers and never reuse them. And ultimately, if something doesn't feel right, do not adjust your dose yourself. Just reach out to your clinical team at Feel30. They're there to support you every step of the way.